Assalamu alaikum. Welcome back. In this video, I have discussed important nursing MCQs. These MCQs are helpful for all nursing exam preparation, and if you are new in my channel, then don't forget to like, share and subscribe. So without wasting time, let's get started. Which of the following electrolyte imbalance is most associated with respiratory alkalosis? Correct answer is option B, hypocalcemia. What is the maximum volume that can be safely injected into the deltoid muscle in adults? Correct answer is option A, 2 ml. Which phase of wound healing involves angiogenesis and collagen deposition? Correct answer is option B, proliferative phase. Which test is most inductive of renal function? Correct answer is option B, serum creatinine. Which is the first drug of choice in anaphylactic shock? Correct answer is option B, epinephrine. What is the appropriate nursing intervention for a client with increased intracranial pressure? Correct answer is option A, elevate the head of the bed 30 degrees. In patients with chronic obstructive pulmonary disease, oxygen therapy should be administered cautiously to prevent. Correct answer is option D, hypercapnia. What is the antidote for benzodiazepine overdose? Correct answer is option B, flumazenil. Which is the most reliable indicator of pain in a patient? Correct answer is option C, patient self-report. Which condition is associated with a positive trossive and Shoestic sign? Correct answer is option B, hypocalcemia. Which medication is contraindicated in a patient with glaucoma? Correct answer is option A, atropine. What is the normal range of central venous pressure? Correct answer is option B, 2 to 8 mm of mercury. In case of a blood transfusion reaction, the first nursing action should be. Correct answer is option A, stop the transfusion immediately. Which is a priority nursing diagnosis for a patient with spinal cord injury at T4? Correct answer is option D, risk for autonomic dysreflexia. Parkland formula for fluid resuscitation in burns is based on. Correct answer is option B, percentage of total body surface area burned. What is the normal urine output in an adult per hour? Correct answer is option B, 30 to 50 ml per hour. What is the first line of management in septic shock? Correct answer is option B, fluid resuscitation. Which of the following is a high priority intervention for a patient with diabetic ketoacidosis? Correct answer is option B, initiate fluid replacement therapy. Which type of isolation is required for a patient with tuberculosis? Correct answer is option C, airborne precautions. The Glasgow Coma Scale assess. Correct answer is option B. Eye-opening verbal response and motor response. What is a critical complication of total parental nutrition? Correct answer is option C. Infection. Which finding is most consistent with acute pulmonary edema? Correct answer is option B. Crackles and pink frothy septum. What is the normal range for arterial blood pH? Correct answer is option B. 7.35 to 7.45. Which of the following is most commonly associated with right-sided heart failure? Correct answer is option B. Peripheral edema. A patient with a chest tube develops a continuous bubbling in the water-sealed chamber. This indicates. Correct answer is option B. An air leak. In patients with hypothyroidism, which laboratory finding is most commonly observed? Correct answer is option C. Decreased T3 and T4 levels. What is the primary concern in patients receiving chemotherapy? Correct answer is option B. Risk of infection. Which vitamin deficiency is most associated with Wernicke-Korsakoff syndrome? Correct answer is option A. Vitamin B1 thiamine. Which of the following is the best indicator of adequate tissue perfusion in a critically ill patient? Correct answer is option C. Urine output. A nurse is administering morphine. Which side effect requires immediate action? Correct answer is option C. Respiratory depression. In cardiopulmonary resuscitation, the recommended compression to ventilation ratio for adults is. Correct answer is option C. 30:2. The therapeutic range for INR in a patient on warfarin therapy is. Correct answer is option B. 2 to 3. What is the hallmark sign of Guillain-Barré syndrome? Correct answer is option A. Ascending paralysis. The medication of choice for treating bradycardia is. Correct answer is option B. Atropine. Which of the following is most commonly associated with diabetic nephropathy? Correct answer is option B. Proteinuria. In hemodialysis, the most significant complication to monitor for. Correct answer is option B. Hypotension. A patient is diagnosed with hepatic encephalopathy. Which dietary restriction is most important? Correct answer is option A. High protein diet. A child is brought in with a barking cough and stridor. The likely diagnosis is. Correct answer is option C. Croup. Which finding is most indicative of an acute hemolytic reaction during a blood transfusion? Correct answer is option C. Back pain and dark urine. What is the preferred position for a patient in shock? Correct answer is option C. Supine with legs elevated. Which medication is used to reverse opioid overdose? Correct answer is option A. The normal level of hemoglobin in adult females is. Correct answer is option B. 12 to 15. Which of the following conditions is associated with Jenny-Stokes respiration? Correct answer is option B. Heart failure. The drug of choice for treating status epilepticus is. Correct answer is option B. Diazepam. Which condition is characterized by the presence of endometrial tissue outside the uterus? Correct answer is option C. Endometriosis. Which vitamin deficiency causes megaloblastic anemia and neurological symptoms? Correct answer is option D. Vitamin B12. Which arterial blood gas abnormality is seen in severe diarrhea? Correct answer is option B. Metabolic acidosis. Which hormone increases blood calcium levels by stimulating bone resorption? Correct answer is option B. Parathyroid hormone. Which condition is diagnosed using a pap smear? Correct answer is option B. Cervical dysplasia. The most common site of metastasis in breast cancer is. Correct answer is option C. Bones.